Hi, I am Patricia Martinez. I am from Mexico and I am the early stage researcher 12 from the PersonalizeAF consortium. The name of my project is Planning Ablation Therapies Using In Silico Methods. And I am currently doing my PhD here at the Karlsruhe Institute of Technology in Germany. And today I'm going to give you a brief introduction of my project. These are the members of my supervisory team, Professor Dr. Olaf Dössel and Dr. Axel Löwe from KIT, and Dr. Maria Guillén from Universidad Politécnica de Valencia. And I will start by introducing the background of my research. And for those who might not be familiarized with the topic, around the world, more than 46.3 million of people suffer from atrial fibrillation. Atrial fibrillation is an arrhythmia where the electrical activation of the atria is uncoordinated. Catheter ablation is a commonly performed procedure to treat patients with atrial fibrillation. And as you can see here on the image, a flexible tube called catheter is introduced into the atria, and the cardiologists aim to identify and eliminate the tissue that is causing the arrhythmia. Although catheter ablation can be an effective therapy, it has been shown that in patients with persistent atrial fibrillation, the success rate at 1 year remains around 52%. So this leads to the motivation of my research. As we have seen, the success rates of catheter ablation in patients with persistent atrial fibrillation remain low. And this might be mainly to two causes. The first one is how well we understand atrial fibrillation. So our comprehension of the complexity of pathological mechanisms that contribute to the initiation, maintenance, and progression of the arrhythmia. And secondly, our limited ability to identify and quantify these mechanisms in the clinics, and also during electrophysiological studies. So in general terms, the goal of my project is to generate an ablation planning tool that targets patient-specific arrhythmia mechanisms. Here you can see two of the most commonly proposed mechanisms for atrial fibrillation. The first one is ectopic focus, and the second one unstable rotors. And one of the questions to generate the virtual heart is which clinical data do we need to personalize the model? We can have, for example, an MRI scan or the electrocardiogram, or we can also use electrophysiological data. Once we decided which data we are going to use, we can then generate a virtual heart of the patient. And with this virtual heart, we will also perform virtual ablation. So a simulation where we could try to identify this ectopic focus, for example, here in the animation. We would perform there a virtual ablation, and then we can share our results with the cardiologist. So in summary, in patients with persistent atrial fibrillation, success rates remain low. In silico methods such as modeling and simulation provide a useful tool to understand and quantify atrial fibrillation mechanisms. And finally, patient-specific models of the atria can help physicians plan ablation and identify ideal target points. Thanks for watching, and do not forget to follow our social media.